Hi viewers, this video is about anatomy of breast. As you all know, the breast are paired structures located on the anterior thoracic wall in the pectoral region. They are present in both males and females, yet they are more prominent in the females following puberty. In female, the breast contain mammary glands. They are accessory glands of the female reproductive system. The mammary glands are the key structures involved in lactation. In this section, we shall look at the anatomy of the breast, their structure, innervation, vascular supply, and clinical relevance. About the surface anatomy. The breast is located on the anterior thoracic wall. It extends horizontally from the lateral border of sternum to the mid-clavicular line. Vertically, it spans between the second and the sixth intercostal cartilages. It lies superficially to the pectoralis major and serratus anterior muscles. In this picture, you can see it extends between, vertically, the breast tissue extends between second and the sixth rib. Then it lies superficially to the pectoralis major muscle. This is the pectoralis major muscle, and here comes the serratus anterior muscle. So it lies anterior to pectoralis major and serratus anterior muscle. The breast can be considered to be composed of two regions, the circular body and the axillary tail. Circular body is the largest and most prominent part of the breast. Axillary tail, it is a smaller part. It runs along the inferior lateral edge of pectoralis major towards the axillary fossa. In this image, you can see the horizontal extension of breast tissue. It extends from lateral border of sternum till here and to the mid-axillary line. Then it has a circular body and an axillary tail. This is the axillary tail, a smaller part that extends to the axillary fossa of the pectoralis major muscle. At the center of the breast is the nipple. It is composed mostly of smooth muscle fibers. Surrounding the nipple, there is a pigmented area of skin termed as areola. There are numerous sebaceous glands within the areola. In this image, you can see this is the body of the breast, and this is the center of the body, and here you can see the nipple. It is composed of smooth muscle fibers. Surrounding the nipple, there is a pigmented area, and that is called the areola. Within the areola, there are numerous sebaceous glands. The breast is composed of mammary glands surrounded by a connective tissue stroma. The mammary glands are modified sweat glands. They consist of a series of ducts and secretory lobules. Each lobule consists of many alveoli drained by a single lactiferous duct. These ducts converge at the nipple like the spokes of a wheel. In this image, you can see this is a thoracic wall. This is the pectoralis major muscle, and the breast tissue or the breast is seen attached to the or in front of pectoralis major muscle. Then within the breast tissue, we can see several mammary glands. These are the mammary glands, these dark colored ones, and they are surrounded by connective tissue stroma. These are the connective tissue stroma surrounding the mammary glands. Each mammary gland is a modified sweat gland. Each gland is composed of lobule and duct. Each gland has, these are lobule, this is one lobule, this is another, like that. So each lobule has a duct draining from it. Within the lobule, you can see several alveoli. This duct or the duct of lobule is called a lactiferous duct. Several lactiferous ducts from different lobules converge at the nipple like the spokes of a wheel. You can see here. This is the spokes of a wheel. Suppose this is the center of the wheel or this is the center of the wheel and the spokes converge at the center of the wheel. So similarly, the lactiferous duct draining from different lobules converge at the nipple like the spokes of a wheel. About connective tissue stroma. The connective tissue stroma is a supporting structure which surrounds the mammary glands. It has a fibrous and a fatty component. The fibrous stroma condenses to form suspensory ligaments known as ligaments of Cooper. These ligaments have two main functions: attach and secure the breast to the dermis and underlying pectoral fascia. The second function, separate secretory lobules of breast. In this image you can see again, this is a thoracic wall, pectoralis minor muscle, pectoralis major muscle and the pectoral fascia. Here you can have the breast tissue. The breast tissue consists of a circular body and nipple at the center. Then within the body you can see the mammary glands. These are the mammary glands. Then each mammary gland is a lobule consisting of several alveoli. Each lobule is drained by lactiferous duct. The lactiferous duct from different lobules join together form lactiferous sinus. Different lactiferous sinus converge at the areola in the nipple like the spokes of a wheel. This much we have seen already. Then in between the mammary gland you can see supporting structures, the white colored things here, and that is called the connective tissue stroma. The connective tissue stroma has fibrous component and fatty component. The fibrous component condenses to form. These are the fibrous component and that is called suspensory ligaments because it attaches the breast tissue to the pectoralis fascia. This is the pectoralis fascia. So these are the suspensory ligaments or otherwise called Cooper ligaments. Also it separates the different lobules of breast. You can see here. This is Cooper ligament. This is another Cooper ligament. You can see a set of lobules here. And similarly, these are Cooper ligaments separating the lobules of breast tissue and also attaching the breast matter to the underlying pectoral fascia. Here you can see the fatty tissue of the connective tissue stroma. We have seen the supporting structure has fatty tissue and Cooper ligaments. Here you can see the fatty tissue surrounding the breast matter or surrounding the lobule or in between the lobule. And in this image you can see the fibrous component of connective tissue, that is the Cooper ligaments. Coming to the pectoral fascia. The base of the breast lies on pectoral fascia. It is a flat sheet of connective tissue associated with the pectoralis major muscle. It acts as an attachment point for the suspensory ligaments or Cooper ligaments or ligaments of Cooper. There is a layer of loose connective tissue between the breast and the pectoral fascia that is known as retromammary space. This is a potential space often used in reconstructive plastic surgeries of breast. In this picture again, this is a simplified picture of the structure of breast. This is the pectoralis major muscle. This is the pectoralis fascia, to which the entire breast matter is attached with the help of Cooper ligaments. This is the Cooper ligament or suspensory ligament. You can see here. Then this Cooper ligament separates one lobule from the other or one mammary gland from the other. This is one lobule, this is another lobule. You can see the separation very clearly in this picture. Then this is the pectoralis fascia, this is the pectoralis minor muscle, and this space is the retromammary space, which is the space between the pectoralis fascia and the breast tissue. This is the space that is used often in reconstructive plastic surgery. Surrounding the mammary gland or lobule, you can see the fatty material or fatty matrix in between and surrounding the mammary glands. This is, as I told you, this is one lobule. Each lobule is drained by a lactiferous duct. The lactiferous duct join together and form lactiferous sinus. Lactiferous sinus open to the nipple. This is in brief about the structure or surface anatomy and internal anatomy of breast tissue. Then, a breast is divided into 4 quadrants using 2 perpendicular plane intersecting at the nipple or the nipple centroid line. You can see here, this is one line, this is another line intersecting at the nipple. Then, it can be divided into the circular body of breast can be divided into 4 quadrants by using 2 perpendicular lines. This is called the upper outer quadrant. This is the lower outer quadrant. This is lower inner quadrant and this is upper inner quadrant. Above the nipple, upper quadrants, outer and inner, and below the nipple, lower quadrant, outer and inner. Coming to the vasculature of breast tissue. The arterial supply to the medial aspect of breast is via internal thoracic artery. It is also called the internal mammary artery. It is a branch of subclavian artery. The lateral part of the breast receives blood from 4 vessels, namely the lateral thoracic branches and the thoracoacromial branches that originate from axillary artery, lateral mammary branches that originate from posterior intercostal artery, and the mammary branch that originate from anterior intercostal arteries. So lateral thoracic artery, thoracoacromial artery, lateral mammary artery, and the mammary branch supplying the lateral part of breast tissue. The medial aspect receives arterial blood supply via internal mammary artery. The veins of breast correspond with the arteries draining into axillary and internal thoracic veins. Coming to the lymphatic. The lymphatics are very important in the metastasis of breast cancer. There are 3 groups of lymph node that receive lymph from breast tissue. They are axillary lymph node 75%, parasternal lymph nodes and posterior intercostal lymph nodes draining 20% and 5% of breast matter. The skin of the breast also receives lymphatic drainage. The skin drains into axillary, inferior, deep cervical and infraclavicular nodes. The nipple and areola drains into supraareolar lymphatic plexus. You can see here the central lymph node, posterior lymph node, pectoral lymph node, apical lymph node and lateral lymph node. Coming to the nerve supply. The breast is innervated by anterior and lateral cutaneous branches of the 4th to 6th intercostal nerves. These nerves contain both sensory and autonomic nerve fibers. It should be noted that the nerves do not control the secretion of milk. This is regulated by the hormone prolactin. It is secreted by the anterior pituitary gland. About the clinical relevance, there is a condition called breast cancer. It is a common surgical condition. 60% of carcinoma of breast occur in the upper lateral quadrant. So the quadrant of breast is important in identifying the tumors of the breast or the carcinomas of the breast. 60% of tumors occurs in the upper outer quadrant. Here is the end of this video. Thanks for watching. Please support this channel by your subscription and sharing.